everyone, and welcome to the first annual conference of Association of Black Psychiatrists. I can't believe it's a year already, and we're here again. I really can't say much about the speakers we've got here. I think that the lineup speaks for itself. Last year has been quite a tumultuous year, and there have been lots going on. We thought that the theme of this conference should kind of reflect what we've been through in the last year. I want to talk about our series on Twitter, which started off the 1st of October, called Celebrating the Greats. I must confess, I feel extremely humbled and unbelievably lucky to be working with two of the great psychiatrists that we've got, Dr. Altha Steward, who would be speaking to us later, and Dr. Aggrey Burke. So without much further ado, and also celebrating the rest of my colleagues who've come from far and beyond, not just psychiatrists, but social workers, psychologists, all that involved in the care of mental health. I just want to say welcome, and without much further ado, I'd like to introduce one of our great psychiatrists.
First, let me say thank you. I'm Dr. Altha Steward. I am an honored guest speaker, and I hope soon to be an honorary member of the Association of Black Psychiatrists in the UK. I am most appreciative and grateful to President Obinwa, who has now twice invited me to offer some opening remarks at a meeting. And I'm especially pleased that I've been asked to be here today, because it was only about a year ago that I first heard about the group as an organization, and I reached out to your founding president to offer congratulations and support for this effort. I cannot tell you how pleased I was with her immediate and gracious response to me, and the offer of the invitation to offer a few words at that first meeting of the association. I considered it my great honor and an opportunity to actually continue selfishly, in some respects, my own goal, having been president of the American Psychiatric Association the year before, my own goal of broadening the global reach of our American association, and that this was an excellent opportunity for me to do just that. I remember well the feeling that I had that day, and I am just as excited and enthusiastic and energized today as I was then. This invitation to speak at the inaugural annual meeting of this, albeit virtually, of this organization pleases me to no end. It's an opportunity for us to continue learning about each other and the way that we work around the globe, across the pond, as it were, and specifically an opportunity for us to continue gathering an understanding of what psychological wellness looks like among people of African descent across the diaspora and around the globe. So as I prepared for these brief remarks today, I could not help but think of the many colleagues who are no longer with us, but who are part of this long legacy of anti-racist work in the global mental health space. It is fitting that the reason we gather to commemorate the birthday of this organization that is now carrying on their work, as well as a few of us legends. I believe that's a reference to you and me, Aggrey. That in that spirit, I will virtually now pour libations in the memory of some of these individuals that include, from our side of the world, Dr. Solomon Carter Fuller, who is noted to be the first African-American psychiatrist in America, Doctors Patricia Newton, Carl Bell, Francis Cress Welsing, Jean Spurlock, Chester Pierce, and of course, Professor Fred Hickling. These people, like so many others who have crossed my path in the last few decades, must be acknowledged as we continue along the work of today. These are the unapologetically and authentically Black African women and men who understood, in the words of the late US Congressman John Lewis, that making good trouble is our job. World-renowned and outspoken lecturers, authors, researchers, and scholars, they mentored a generation of younger psychiatrists like myself back in the day, and other mental health professionals in the qualities needed to be an excellent professional and an authentic person in all their African excellence. So I want to begin with just a brief bit of the history of racism and mental health in the post-colonization world, and conclude with a few components of an effective approach for addressing racism in mental health. I think it's fitting that this conference is being held, unfortunately, at a time when, in America at least, and the world in some respects, is finally coming to grips with our racist past in ways never really acknowledged by those with white privilege before. It is particularly poignant that this acknowledgement is happening around the world in that broader society and within the field of psychiatry as well. For many within the Black psychiatric community, we realize what the price for that achievement and excellence has been for many African descended people scattered around the globe. For many years, at least in the US, many in mainstream psychiatry did not even consider or acknowledge and recognize the historic baggage that this issue raised in the psyche of Black people, directly related to the history of our nation and its treatment of Blacks from the beginning. Euphemisms, both words and behaviors, covered over the reality of the brutality, physical and psychological, and of the day-to-day existence for enslaved populations, torn from their homelands by brutal enslavers from many European nations for the profit and to maintain their privilege. And around the world in the last couple of years, with the pandemic, we have seen the rise in psychological distress experienced by many in communities of color, whether we call them BIPOC, as we do here in the United States, or BAME, Black African and mixed ethnicity, minority ethnicity, depending on which side of the pond we reside. Psychiatric, psychological, and other behavioral health professional organizations, as well as the representative medical societies, have been quick to issue statements of apology or support, and sometimes both. And they've acknowledged the wrongful acts and structural barriers that were created to maintain a culture of white supremacy and privilege, as most of the world inhabited by people of color was brutally colonized and its people horribly scarred by the trauma of these experiences. And yet we are assembled here today as the evidence of the resilience of these people upon whose shoulders we stand. We have overcome those structural barriers with accomplishments often much larger than our ancestors could have ever imagined. And in the words of Maya Angelou, still we rise. I remember that during my presidency, I met with Wendy and Adrian from the Royal College, and we talked about some of the shared experiences of our respective groups, minority groups in our respective countries. It was incredible to me at the time that in two different geographic locations, we recounted similar issues: police brutality against BAME individuals in the UK and against Black people in the United States, hate crimes, and other racially motivated incidents on the rise, concerns being raised by Black health professionals, and the list has only grown over the last few years. The recent turmoil in response to police brutality against Black communities in the United States and other Western countries has led the American Psychological Association to define racism as a pandemic in and of itself. It's also prompted many of our associations for mental health professionals, including your own college, my APA, the Royal College of New Zealand and Australia, the American Psychological Association, the Canadian Psychological Association, the World Psychological Association, to issue statements against racism and take a stand to make it imperative that we do more than talk. Unfortunately, while these statements have been developed regarding issues of racism, most have offered very few directly applicable solutions to the problem. And it is this lack of solutions that brings us today to this conference on racism and mental health. In this face of individual, institutional, and systemic racism, as Angela Davis writes, it is not enough to be non-racist. We must be anti-racist. And the care that psychiatrists and other mental health professionals give, especially that care that is given to people of color around the globe, must also be anti-racist. Anti-racist mental health care recognizes issues related to racial discrimination and racism and addresses their potential consequences and the racialized experiences of Black people and other people of color. And to do so, psychiatrists, psychologists, and other mental health professionals must first be open-minded and then be trained. Anti-racist care goes beyond transcultural care or cultural competency. It integrates both culture and the aspects and needs of a population seeking health care, and it must address reparation for the harm that is caused by that racial discrimination, by that racial profiling, the racism and the microaggressions. And although the consequences of these things are very well known and have been so for a long time, the people who are experiencing mental health problems know that we are not doing enough. We need more research. We need more attention to appropriate kinds of clinical care and models of treatment that address those cultural needs. We need to be very clear that the kinds of issues that we are dealing with in communities of color, the mental health and psychological distress, the chronic medical conditions that derive from social determinants of health that are man-made, that are part of structural barriers put in place specifically to not provide that kind of care. We need to understand, and I think understand quite well, that we have an obligation to the people that we serve, those people of color, to begin to thinking about providing mental health services from an anti-racist approach. We have to make the decision from public policy, from advocacy, to addressing and developing new kinds and models of treatment, to looking at the research that needs to be done and pushing to have that research done. We have to remember that this fight started long before any of us came on the scene. I go back and believe that for me, reading the work of Frantz Fanon was the beginning of my understanding what being anti-racist as a psychiatrist would mean. His work was the basis for the theme of a conference at which I spoke a few years ago in Jamaica, and where his daughter, Muriel, also spoke. And it was the first time that I actually heard the word anti-racist used in this context. Now, I can't say with certainty that she coined the term, but I will credit her with giving it to me that first time. I encourage you in this audience to take a minute and read some of his work if you have not already. Not only because of the richness of his writing as a blend of psychiatry and science and philosophy and politics, but also to realize that in real ways, his work was a precursor to much of the work that we are attempting to do today in this space that we have designated as anti-racist psychiatry, anti-racist mental health. It is so important that I want to just share one quote that I am very fond of from his work, The Wretched of the Earth. All that the native has seen in his country is that they can freely arrest him, beat him, starve him, and no professor of ethics, no priest, and I would add no physician has ever come to be beaten in his place, nor to share their bread with him. This is a profound statement on what we have witnessed personally in the last couple of years happening to people of color, and as physicians, as mental health professionals from around the globe, as people who care and who advocate for people with mental illness and for people with mental illness who may themselves be on this call. Fanon tackled that quintessential question about the relationship between the individual and social structure, i.e., I would argue, structural and systemic racism, especially when that system is what is oppressing the individual in the first place. And we know all too well, these conditions exist today in very real ways in all of our areas. And so for me, Fanon remains relevant today as the father, in my mind, of the understanding of how we attack systemic and structural racism. As APA president, I dealt with a lot of different groups and people. I witnessed firsthand some of the cutting edge work that was going on around the globe. And I will just take this moment to mention the Caramensa program in Jamaica, and how proud I am to have witnessed that program in its infancy and development, and to have heard Professor Hickling proclaim it is the only model for mental health prevention in the world, and to witness that happen. I was also pleased to be in the audience when the Ministry of Health decided that it was going to expand its funding to support the program that was proving so effective in the lives of children and family there, to put them on a different trajectory in life and to create a different path for them. Now, I know that I only was supposed to talk for a few minutes, and I am probably about to exceed my time if I have not already. So I'm going to close with a couple of things that I would just share with you as action steps. One is that in order to practice anti-racist mental health as an approach to improving the mental health of people of color, we have to be transparent, clear communication in all that means: clarity, consistency, honesty in our communication with the people we are hoping to serve and the people that we work with and are training. Transparency is essential. We cannot hide behind the curtain and be the wizard pulling the levers and just telling people to trust us. We really have to create relationships and collaborations that are based on transparency. Intentionality. This stuff does not happen by making a wish. It is hard work, but it must be intentional work if we are to ever reclaim the trust of the people who right now do not primarily trust a mental health system that is based on an oppressive structure, that is built on a white supremacist framework, that is the sequelae and history that comes from a colonizing in mentality by people who continue to see themselves as privileged in that colonizing way. We must make a strong commitment to doing this work. And I would argue we must make a strong commitment to working together around the globe to do this work. I was honored to have been invited as the president of the APA to many different places in the world. And one of the things that I saw without fail was that people working together as professionals and the people being served were the best combination of change and progress that I ever saw. I'm still trying to create a model like the grandmother's bench in Africa for communities of color in the United States who so strongly mistrust our system of care, that if we don't get credible messengers from the community, people that they trust, to begin the process of engaging them, we won't make any headway. And then finally, holding ourselves accountable as individuals and systems, and making systems accountable to the people that we serve. If we can do those four things: transparency, intentionality, commitment, and accountability, we will be well on the way to creating a global approach to an anti-racist approach to improving mental health care for people of color, and most especially for people throughout the African diaspora. Thank you so much for inviting me again. Thanks for paying attention and being here and listening to me ramble a bit. And thanks for honoring this legend, as Aggrey and I are now known, in this very important moment in the history of the Association of Black Psychiatrists in the UK. Thank you.
Thank you very much, Dr. Steward. You've given us food for thought as usual. And I want to say again, I am extremely humbled and proud to be on the same platform as you. Thank you very much. And we'll just bring in Dr. Burke. There were problems with the connection. Dr. Burke, can you please join us and to say a few words?
Are you hearing me now?
Yes, we can, sir.
It's a great pleasure to be here today. Perhaps it went the right way, and thank you, Professor Steward, for an inspirational and important lecture presentation on where we are today. And in remembering Professor Hickling and my other colleague, Dr. Wayne Edwards, who died in April of this year, he was trained here, he was from Trinidad. We remember stalwarts who came before us and have gone before us. Today, I want to mention a couple of things in my short presentation. I was looking at the issue of permanent exclusion from school. And, you know, we have permanent exclusion from society and from our profession. And we have people who are killed whilst in custody, or killed whilst in mental health detention. And that's permanent exclusion as well. And so it's important to know what are the correlates of permanent exclusion. And these are the adverse child of residence, truancy at school, having any behavioral problem in childhood, substance abuse disorder, and borderline personality disorder. And here in Britain, for reasons unclear, we don't seem to have borderline personality disorder. So the question is it likely that the 6 times increased rate of permanent exclusion from school leads to 6 times greater rate of borderline personality disorder, which has been subsumed into the category schizophrenia? And so we wonder what that's about. But that does not explain why it is that when a Black man is in the room, the elephant is in the room, the elephant enters if a Black man enters. And the question is, is this the designation or way of labeling the Black man, the elephant, as a dangerous man, and he should be excluded from the room? And there is the issue of the society. And I carried out a study of people who were repatriated to Jamaica for reasons of the situation here in Britain didn't seem to be likely to be as good as Jamaica. Jamaica is very poor. We have hurricanes and that kind of thing. It's very hot and poor. But people were repatriated, and there's a constant plan to deport people because it seems to the authorities here or colleagues here that it would be a better place to be under a coconut tree or a banana tree and you'd get better. And so I did this study in Jamaica and found that that was not the case. People did not get better. In fact, they retreated to the bush. Some jumped into the sea. They did not get better because the situation they went into, they returned to, was one filled with stigma and filled with poverty, which they were returning to. So the question then becomes, what then here in Britain are we likely to see in terms of permanent exclusion from society? And of course, it is death. And we have Seni's law, which followed the death of Olaseni Lewis in 2010. 11 years ago, 11 officers were involved in a process of restraining him and he died. And the Seni's law has come forward to prevent this. And that is good news. But we have had so many people died in custody. And it is the elephant in the room. We are elephants, us Black men. But to say it's only Black men would be wrong because women have the same problem of their children being taken away from them, excluded from their care because of their difficulties in life. I'm so grateful to you to have invited me here today. And the conference is wonderful. It's wonderful news for us because, you know, in 1984, we had a conference on racism and mental health, mental illness. But it was too early. It was far too early because the society we live in wasn't prepared for it then. And the number of warriors who would be carrying the program forward retreated. So it's a challenge. We have to be proud and we have to be bold. And you know, whatever I can do, I will do. Thank you so much for inviting me here today. I hope the conference goes well. Thank you.
Thank you, Dr. Burke. Thank you very much. It's always an honor to have you. And as usual, you always give us food for thought and reflections for us to go back and mull over later. Thank you.